Hi, hello everyone. My name is Laura, and today I want to address and talk about a little bit of a topic regarding of the postpartum depression. Many of us sometimes we feel sad in a way, but as women, we feel a sadness that it's beyond different of what a regular sadness is, and that's the postpartum depression. Today in this society, many women go through postpartum depression, and sometimes they don't even know what is the postpartum depression or why they are feeling that way. So today, like I said, I want to talk about the type of sadness and the symptoms that women go through when they have the postpartum depression. I was once a victim of postpartum depression, and I will discuss some of the emotional symptoms that us as a woman go through after having a baby. I have gained experience through the years because twice of my pregnancy, unfortunately, I went to the postpartum depression. And nowadays, 70 to 80% of the women, unfortunately, have postpartum depression. And you might ask yourself, why are we talking about postpartum depression? And let me tell you, postpartum depression is something that can happen to anyone. It could be a relative, a friend, a mother, a sister. And it's important that we know at least a little bit of the symptoms. How can we detect it? And how can we difference when a pregnant woman after the birth is going to postpartum depression? Approximately, like I mentioned before, 70 to 80% of the women will experience a minimum or something called baby blues, or a more severe condition, which is the postpartum depression. After the labor of a baby, women will feel sadness or emptiness, and they will ask themselves why I feel this way. And it's sometimes they won't have the questions to the different symptoms that they experiencing. Some women will experience extreme sadness after the birth of the baby. Some of them won't feel that attachment to the baby, and that's something that they not can control. It just happened. Postpartum depression can affect any woman, and it's a global issue. But before we get into a little bit more of the details of postpartum depression, let's first talk about from where women get postpartum depression. Postpartum depression, it's a mood disorder that affects women after a child. But researchers says it can cause by hormonal changes and emotional factors. Also, postpartum can be caused by environmental factors. Cause will vary mother to mother. Also, the genetics could be involved, and also it can be a factor that could lead to the postpartum depression. There's no evidence that links the postpartum depression disorders to emotional connections to the conditions. One study found that women with a family history of postpartum depression developed the depression after the first pregnancy. Also, studies found that significant twins can hereditary the rate of having postpartum depression. That means postpartum depression can be carried through our genetics. For our main point, it's that symptoms that women gets with the postpartum depression disorder, it shows that it can be more carried through the genetics, like I mentioned. Mothers after a child will feel tired and experience insomnia. They that tiredness will lead to sadness, and the sadness will lead to tiredness, and that will bring us mood changes. Postpartum creates emotional disattachment from the mother to the baby. Also, it can make feel the mother the lack of interest to the newborn. Some mothers will feel hopeless, and once the baby cries a lot, they could feel that, oh my God, what can I do? Why is the baby crying so much? And this is one of the symptoms, unfortunately, of the postpartum depression. Also, postpartum depression can create a sensation of irritability. But it's important for me to address that we as a woman that go through postpartum depression, we could talk, and some women don't like to express or don't like to talk when they're going through this mood disorder. Also, to talk to a mother that could change her perspective, and it could give her some sort of a relief to what she's going through. There's no particular cause for the postpartum depression, so it could be and it could go undiagnosed, and also it can last up to the first 6 months of the baby was born. The postpartum depression, it's a mental health disorder that many women go through, and it triggers and affects them in each a different way. And there's symptoms that it can reveal that someone is facing postpartum depression. So if you have a sister, a friend that it's pregnant, and you feel that they could go through postpartum depression, talk to them and let them know that you're there for them. Let them an ear or let them a hand, because it's a global disorder what affects our women. Thank you.